Today we're going to learn about anti-Müllerian hormone, or AMH, and what is it and why does it matter? AMH stands for anti-Müllerian hormone. It is one of the 3 tests that we can use to assess ovarian reserve. Your body makes the most number of eggs it's ever going to make when you're a baby in your mommy's womb. By the time you're born, it's already down to 2 million, and by the time you have your first period, it's down to about 300,000 eggs. What we try to do is get an idea of how many eggs you have left. Your body has this pool of eggs, okay? They're kind of in a dormant or kind of sleeping phase. And then each month, your body pulls a little bit of these eggs from the pool, and the number it pulls is proportional to how many you have left. So if you have a higher number of eggs left, it's gonna, be a little bit more generous and pull a couple more eggs that month compared to if you have a lower reserve. Now, the anti-Müllerian hormone, this is produced in what's called the granulosa cells, and these are the cells that are surrounding the egg. And so if more eggs are being pulled out each month, this means more granulosa cells present and thus a higher production of AMH. AMH is on a scale. Anti-Müllerian hormone decreases as a woman ages. And so depending on your age, you may have a higher AMH, and that's kind of more in the normal range. And if you're a little bit older, your AMH may be lower, but that may be in the normal range for your age. Now, there are things that may contribute to a higher AMH. One of those would be, for instance, if you have something called PCOS, or polycystic ovarian syndrome. And what happens with patients that have PCOS is that they may have a high number of eggs. The higher AMH, we think, may actually block you from developing a dominant egg, and therefore you may be having difficulties conceiving even though you do have that high AMH level. There are multiple things that lead to a low AMH. Number 1, just advancing age. Anti-Müllerian hormone decreases as a woman ages. Number 2 could be a diminished ovarian reserve. And what this is that for your age, anti-Müllerian hormone, and maybe even the other testing that we perform along with an anti-Müllerian hormone, show signs that perhaps your ovarian pool may be a little bit lower for you compared to people in your same age group or your similar situation. The AMH test is one of our best and most reliable predictors of ovarian reserve. Anti-Müllerian hormone, or AMH, it's not the best predictor for outcomes, meaning your chances to conceive. So that means you may have a very low AMH. Does this mean you'll never get pregnant? Absolutely not. It does, however, get us an idea of how your body may respond to our treatments. So if you're undergoing fertility preservation, for example, we may say, okay, we think we can get a good number of eggs. You may need a second cycle to reach the number that you desire. Or it helps us, again, figure out medications from our stimulation standpoint and what dose of medications we would want to use for the most optimal outcomes. The most important thing is if you get your level, or when you get your level, to be able to talk to a reproductive endocrinologist, put your whole picture in mind, and give you the most accurate assessment of where you are in your fertility and what treatments you may or may not need to be able to move forward.